Hey guys, how's it going? Let me get y'all up here in the crane. Looking at some critical care today. For just a second anyway. How's everybody's week going? Today's Wednesday. The boys had a dance at the school today for Christmas. So just finished picking them up. Hey, Go-Kart, how's it going? Good to see you. Hey, Cynthia. Hey, Mello. Hey, About Moon. Hey, Sammy. Hey, Rebecca. Hey, Mary. Hey, Queen. Hello, Kim. Hey, Caitlin. Hey, Lynn. Good to see you. Hey, May May. How's it going, guys? Hey, Brenda. My poor book, after a year, it looks pretty bad, but hey, V. Hey, Vivi. Hey, JL. Hey, Waynes. Hey, Lynn. Let's see. Okay, I ordered the UU recommended. Now I have stated the AAPC program. Oh, you probably started. Any tips? The birthday boy had a great little birthday. We went to, thank you for asking, Go-Kart. Let me see my camera. I got my kitty cats on camera today. They never sit together, so that was weird. But let's see, what else have I got in here? Today was their Christmas dance, so they both wore Snoopy outfits. They're going to hate me when they're 30 years old. There's his cake. He had a Sagittarius cake. He's 14, and bows and arrows are pretty cool. It was really cupcakes, but that makes it easier when you pull them apart. The cupcakes, you don't have to cut or slice any pieces and put them in there. So we always get a cupcake cake, half vanilla, half chocolate, so you can just pull apart the little cupcakes. We were all at a samurai sushi place. They brought some friends, and one of those places where they light the fire and the grill and all that stuff. So yeah, they had a big old time. It's Travis fixing to catch some of that throwing rice, whatever they do. There you go. He's good at it. He catches all three. He does a good job. He missed the fourth, but the guy made it really short. This guy, Vinny, that's one of their friends. He's like, no way, I'm not doing it. I'll pretend I caught it. And then there's Jaybird, my baby. He's still 13 till May. He won't be 14 till May. But yeah, we had a good birthday. We had a good time. The guy walked out of the kitchen all on flames or something. Like his hat was completely on fire when he walked out of the kitchen. So that was funny. That was interesting. They are fiery people. User 9625 just became #1 gifter badge. Thank you so much. All right. You love the sweaters. Snoopy is so cute. Plus, I put them in matching sweaters like they're twins, but they're 6 months apart. So they get all picked on at school, of course. I am going to answer your question about advice from the school. Yes. let me get I just bought another course from AAPC so I can actually show you in the course what you need to do. So we've got some anatomy questions we're going to do today and some other ones. Let's see, anatomy, modifiers, and guidelines, and probably some radiology. So hang out for that. But for those guys that are doing Blackboard courses from AAPC, I just bought another course from them. So let's go to my courses real quick. So when you're in here, I bought Ambulatory Service Center Specialty course just because it was $99 yesterday, and it's something I've never looked at their practice questions or anything for that, so I thought that might be cool. I also have their E&M course, but it won't start till January 1st, so I can't look into that, but I did buy this one today. And when you're here, even if you have the AAPC course, be sure and go to your course materials, because here sometimes they give you the answer key to all of your course lecture answers. So in the middle of your course, if they're asking you questions that are 1 or 2 questions at a time, you get those answer keys. Let me show you what one will look like. Sometimes they're not like, it's here, but it might not look like it's an answer key, but it is an answer key. Let me find one of my old ones and show you what it looks like if I have it on this computer. Let me think. It might be under downloads. Let me see. I find a lot of people don't know that they're there, but they're there. Let's see. That's not it. No, I don't have it on this computer. It's going to be on another computer. I'm sorry, guys. But, yeah, be sure and look over every piece of paper that is downloadable underneath your course materials. Now, of course, I bought this course today, which it's 2022, but the course that they're selling for $99 is from 2021, so they don't update a lot of stuff. But first thing, go through that. The lectures, when you're in the lectures, just know that they can be read to you, of course. If you are in anything for Vital Source, that they give you a PDF version of their study guide or whatever else is going on. Be sure while you're in VitaSource that you come over here to this far, far, far right side and click the 3 dots over here and have the book read out loud to you. That way you're hands-free. You're not sitting in front of the screen, killing your eyes. Just have it read all the lecture stuff to you. Don't try to read it with your eyes and then make notes. Just do that. When you're in the course too, and it comes to, let's see, do I still have it up? Yeah. When you're in the middle of your study guide, that might be electronic version, it'll look different. It'll be in that VitaSource. But when you get to the section review questions that are just little practice questions, be sure you copy and paste all those into a Word document with your rationale and save it for every single chapter, every one of the reviews. Because you can click on it and it'll show you the answer in the middle of it. And then copy and paste those into a Word document and save it. Also, your exams for that chapter. So when you're in, let me go back to Blackboard, and you go here to do one of your assessments for the end of the chapter or whatever. I guess this one doesn't have chapters. It's only 3 chapters they're lecturing us on and then going to do a final assessment. It's a super small course. But when you do this, your exams, If you don't pass it the first time, it doesn't matter, or even if you do, be sure, because you can highlight everything on this page after you hit submit, and it gives you the grade, and it shows you how you did on that page. Copy and highlight because it has the rationale all on one page, which is super nice. Then you can paste it into a Word document and save all your questions, all your practice questions throughout the whole course for each chapter. Super handy dandy. I did that for the CPMA course that I took last year. I have the whole study guide that was in VitaSource, which you can copy and paste from. So like if I'm in VitaSource, you can copy any little thing, and you can either hit their copy or you can make your own copy by right click, whatever. But if you do their copy, they're not going to let you copy an entire book in one point. They'll let you copy maybe 500 words, and then it will stop, and then you got to go back and copy another 500 words if you use this particular copy. Anyway, but save every single practice exam question throughout your entire course and study guide, even if it's all on VitaSource. Save them, put them on a Word document. If you don't have Word, then use any kind of notepad that you might have, and just save them, because that's going to be the meat and bread of your studying. Because then you can take those questions and just write a little snippet about them, or add key words from those questions to your exam or your CPT reference book is what they call it. They call it a reference book. But these are all words I got from their study questions. If they were doing a patient for ICU follow-up, it ended up being a subsequent hospital care visit. If they were seen yesterday or the other day, or staff manages a patient in ICU, it always ended up being a subsequent visit. Just take words from those questions that are not in the CPT code descriptors and add them here. The patient was in the last 2 days. It ended up being a subsequent patient. Over here for observation, those are my keywords there that came from those practice exam questions, like increased heart rate, wheezing, asthma. Again, more words like follow-up the other day. That ended up being subsequent observation. These ended up being current admit observation ones. Continuing, examining. Sorry, you have to turn your camera sideways. But these words you can write around the codes that come from your whole entire course, and that will help out a whole bunch, because you could have a whole entire course inside there, your reference books that you get to take and be an open book exam, and that will be huge. I wish my course was a little bit bigger to show you some more stuff, but that one ended up being super tiny. But I'll be glad to see some of the surgical scenarios in this one. This is the syllabus for the course: ambulatory surgical center preparation for a CASCC certification. It's still a 4-hour exam. Oh, for the certification. Okay. We will get 35 multiple choice practice questions with these, I guess, at some point. And anyway, these are the objectives of that course. So I was hoping they could teach me something about ambulatory surgical center coding. Don't know. We'll see. Hopefully I could get access to more questions, because they'll be in those chapter reviews, and that should help. Sorry if I missed your chat. I was busy showing y'all stuff, so I wasn't able to read chat. A lot of times when I'm focused and teaching, I'm not reading chat, so I'm sorry, but I do have quite a few moderators like MK and Red and Twinkle and TikTok Mom in there to help you guys out and answer some questions. I also have, I watched this TikTok today where this doctor had an AI program write a prior auth letter to an insurance company, HealthNet, for him by just asking the AI to do it. So I thought that was really cool. And I had it help me today to make that blog I sent out for you guys, the one with the modifiers 26 and TC today. I asked the AI to write that, and they did. So I thought that was cool. Anyway, it saved me a few minutes. I edited it and then added my own layman's terms to it. I wonder where it's at. Is it here? Yeah. It's called Chat. I don't know what this is. Chat. There it is. Up here, way up here. Chat.openai.com chat. Anyway, I had it, you can see where the article that they wrote right there was super small. And I said, okay, well, I need reference material with it. I had them rewrite it. And then they wrote it with the 3 paragraphs with the reference material with it. So that only took me 2 sentences to write there. And then it helped me write that. And then I edited it and then put in my layman's terms. So it's kind of cool. So you people that are in the HIM or other associate's degree, classes, if you need an essay typed for you really quickly with references, this is really cool. It's really, really cool. I even had them write me a letter because I'm getting super popular. And I'm like, how do I write a letter that says, I'm sorry, I can't get to your email? And it wrote it out for me too. So I had that added. I have 5,000 YouTube followers now, and I don't know how many, 17,000 on TikTok, and I don't know how many everywhere else, but I am getting a lot of emails needing personal, here's my story, can you help me? And of course, I can help you all. You just need to go and watch my 3 pinned TikToks that tell you where to start, absolutely, and then follow our lives that we do here 3 nights a week. Get your CPT book is one of the first ones you need to get. Go on and get the 2023 and just follow along. Be sure and join the Discord group. And I promise it all looks really weird and overwhelming at first, but if you start out with my website, which tells you how to do your book prep step by step, under a tab that says CPT Book Prep, and then you watch the videos, and when you can't be here live, you watch the repeats on YouTube. I promise I'm going to help you. I can help you pass that exam. One way or another, I'm going to help you pass. Whether you buy anything or not, that's not my main thing. We've got on my website, of course, I've got the blog that I did today. I've got tutoring and workshops listed there. Under members only, I have the CPT book prep. It will show you step by step on how to prep your book. You don't need any prerequisites to get into medical coding. You just need to prep these reference materials to take an open book exam with, and you can use my website for that. All my social media links on where to find me and what I'm doing is all right here. Please be sure and join that Discord group by clicking this button after you download the Discord app. It's all free. This is where you get instant help. If I'm not replying to your messages, post your question into Discord. There's 2,000 people in there, and they're all in the same boat as you or have already passed and are just hanging out to help you. So post whatever you need in here, and somebody will be able to help you. And then this is also when I go live and do interactive classes, all for free for you guys to help out and get you to pass your exam. And please follow on TikTok. Yep. Let's see. And membership on my website is totally free too. So, Yep. And social medias and extra educators is totally free. You don't even have to sign up for my website to see those. So lots of help. The only things that I sell is one-on-one tutoring. The workshops that I do are only $10 each. And those are for 3-hour workshops. And then just copies of page by page of my notes is what I sell. Other than that, everything else I try to do for you guys is free. And my main purpose is to help you guys, for sure. All right. And let's see. We're going back to questions, aren't we? Let's start out with some anatomy questions. Let's see. Yes, it sure does apply to all certifications. I've not seen, I've helped HEMA people, NHA people, all certifications across the board for AAPC especially, because I've audited all their courses. I've done their CIC, CPB, COC, tons of their courses. And so, of course, any of their certification. HEMA, I would love to, too. Take their exam. It's just you have to go in person to take their exam. It is on a computer, but I live so remote. I'm like 5 hours away from Phoenix, where I would have to go in person to take an exam for a HEMA. So, and that's just one way, and then drive back. So I would love to take theirs. Whenever I get enough time, I would love to do that. And NHA will not let you take their certification unless you take their course. And I don't want to do that because it's a pretty expensive one. It's not going to be like $99, and plus they make you get the associate's degree, which I've already gone way back past all that. So, but yes, I've helped lots of people. And plus y'all have your own practice exam rooms in my lovely little Discord. So if you are in my Discord, no matter what certification you're getting, I have rooms for you guys too, so that you can go in here and y'all can practice your own practice exam questions and get advice from here. I've purchased everybody's exam questions, whether it's for risk, COC, CIC, any specialty certification from HEMA even. I've purchased all y'all's books and questions just so I can help you guys. So like on that VitaSource, this one right here is a HEMA's, and I have everything. Whatever y'all need help with, I can help with. So I just want to be in the know of everything instead of, only knowing one thing for you guys. So one of my very first that I helped pass was Janet, and she was CCS. Anyway, everything and anything, even books that are on Amazon and stuff, I've purchased all of them just to see if they're worthy of telling you guys to purchase or not, all that kind of stuff. AMA books, you name it, I buy them all. You took your exam early this year with 2021 books, and I want to take it again, but I'm not ready. Sweetie, you're going to have to switch over to 2023 books. Or you can get from a place called, let me type it right here. There's a place called abebooksonline.com, something like that. They have 2022 books for $50 each, somewhere around there. They have the AAPC version of the ICD-10 and the HitPix, and then the AMA version of the CPT book. And they're all around $50 to $40 each with free shipping for 2022. You can buy them from there, and then that would only be $150 instead of upgrading to the 2023 versions. But you will have to edit your 2022 CPT book to make it into a 2023, which I've done for you on there's a document I sell for $20 or something that will show you exactly what to write in your 2022 book and where. And then I also show you a picture of the 2023 book of how it's typed in case you can't read my handwriting. So anyway, but that will save you some money. But you can, but if you have the money, get the 2023. But that is a way you can save some money. And I do recommend getting the AAPC versions of the HIPIC and the ICD-10 instead of Optum and other versions, because even just this week, I saw somebody took their certification exam from AAPC, and a lot of their ICD-10 questions were from decision trees. I think they said they had 3 questions on their decision trees, meaning AAPC in their own ICD-10 book have these decision trees that they write and copyright into their notes or into the codes, and their questions are going to be directly from these decision trees. So they really like doing that. And I don't know what version she had. Maybe it was H or C, but she had questions from that AAPC book. And they don't tell you ahead of time that you're at a disadvantage, but try to find the cheapest versions you can get, of course. Book Run, yep, Book Run. Anything, just do a Google search for AAPC. Well, just do a Google search for AAPC, ICD, and then 2022 if you're looking to get a cheaper version. And then change your search to shopping. And this can usually help you find the cheapest version from an online bookstore. AAPC is selling it for $79, but they're going to charge you $25 shipping. So try to find one from a bookstore. I have my phone on desktop mode instead of Android mode, which drives me nuts, but some websites you have to do it. eBay. Look, McCary has one for $42 free with shipping. McCary is a great site. I sell stuff on McCary once a year for when my car tags are due. Super helpful site. You can sell anything on there. Anything at all. Do not buy tabs. You don't need to tab your books. Don't go all there. Nope. Yeah, nothing else. I don't see anything else. But that was looking for 2022. You might be able to find some 2023 cheaper too. You're welcome. All right. Book Run. I bought a book from Book Run, and it was actually my 2023 CPT book. They accidentally had priced wrong at $51, and they sent it to me with free shipping, and that was a 2023 book. Accidentally. They had 3 of them. I knew I should have bought all 3, but I thought it was a scam, or I wouldn't get them, so I only bought the one. But goodness. I wanted to retake my CPC exam. Any helpful suggestions? Yes, don't read the questions. Thank you for the December. Love it. All that money goes back to you guys. I give away free contest on Friday for free tutoring and free copies of my notes. So any money coming in from the subscribers here on TikTok or YouTube goes back to that. But yes, advice. Do not read the questions. Go to the answers first, see what your differences are first, and only look for those differences in the questions. Learn how to do the process of elimination. Look for similarities. Nobody's ever in the ER. Nobody's ever getting a consult. And, gosh, take your peppermints. And be sure to put your books and set out your clothes and all that stuff in the car the day before. fill up your gas tank. Don't be doing that the day of. And show up 45 minutes to the site location for your exam. Do not show up at 8 o'clock when your exam starts at 8:15. I know whatever it says on that piece of paper is not valid, because I had somebody show up this weekend at 8 o'clock for an exam that started at 8:15, and they wouldn't let her in the door. And she has that printout. And it doesn't matter. They're not going to let you in the door. You whatever it says, 45 minutes early. I did too. I showed up 20 minutes early, and I was the last one to arrive. And all the seats were taken except for front row in front of the proctors. I'm like, what the hell? I didn't even know that. That was way back in 2019. So, yeah. And one of the proctors talked to her out in the parking lot and said, you can't park there. You need to move your car. So she went to move her car, with all of her reference material books in her hand. The proctor saw her out in the parking lot, told her to go move, and by the time she moved her car, got back to the meeting, she was locked out. Just devastating. So please show up 45 minutes early. No lie. Okay. Good advice. Help me understand the process of elimination. Yes, you got it. Hang on to this live, and I will help you out as soon as I finish this anatomy questions. Yeah, isn't that devastating? I mean, you talk to the proctor, and then they won't let you in the building. Oh, Lord. Yeah. Mean. Meanie meanies. All right, guys. Are we A, B, C, or D? Think about these endings and what they mean, and what is the question asking you. I don't know about the decision tree questions. I know they were ICD-10s, and they were about their decision trees. I'm assuming they're diabetes ones because it's one of their biggest decision trees. There's also one here in the CPT book in cardiology. It's not an AAPC decision tree, but it's around the ECMOs. This ECMO one, I've seen them ask, and their question was, this was A, this was B, this was C, and this was D. And they took one of them out and added in another word, and you just had to go to this decision tree, and you had to go to this sidebar and find the one that is not there. A lot of people made it to this decision tree, but were looking inside of it for the answer, but didn't realize that their question was just these words right here. But that's one of them that I know that was on their exam. That's why they're pink highlighted in my book. If I know for sure it was ever a question on a CPC exam. Now, I took mine in 2019, so some of the pinks are from then, but other ones are valid ones that I know that somebody has told me was an exact question, and I found the question and I know what it was, then I pink highlight them in my notes. But something like that. I know the diabetes decision tree is a big one. Don't know. I have not stopped long enough to read what she told me this weekend, other than I just skimmed it, and she said 3 of them were decision tree questions, and I'm like, oh my Lord, remembered that and moved on, but I've got to go back and see what exactly she said about it. Everybody's saying D on this one? Correct. Here's the definition for all of them. Get them all onto one screen for you. And we were looking for eyes. Which of the following diseases is malignancy of the lymphatic system, which you do not want? There's even lymphatic tissue in your fingers. Did you know that? Even going through anatomy, A&P 1 and 2, way back in the day before I did labor and delivery, in 1990 when I was in college, A&P 1 and 2 is no joke. They teach you all kinds of mess. But I didn't know our lymphatic system went all the way up, all the way into our fingertips. And we had little nodules here too. So it goes everywhere. We've got A's, B's, and D's. Nobody likes C. And A is the answer, yes. I think of lymph nodes and I think of your armpits and groin. I don't know why. They're all over. They are all over. There are definitions for everything else there too, in case you need it. Which end or suffix of the word is considered, what? A drug? Oh, okay, is pril. What kind of drugs end in pril? Are they antivirals, ACE inhibitors, beta blockers, or H2 antagonist? Chlorophyll. I can remember that one off the top of my head. Thank you, XO. Thank you, ID. I hope I can help you. Hey, Meemaw. Good to see you again. Hey, Queen. My Scorpio. ACE inhibitors. Yes, indeed. Antivirals do have a V in them, so that's super helpful. Beta blockers have the OL in them, and the antagonists have dyne in them. Hey, PJ, how's it going? Yep, lisinopril. Yep, that one is pretty good, but it usually makes people cough. So you can always tell in a room of generally men that are in a big, huge coliseum or big room gathering, the ones that have a constant cough for no reason. They're not congested. They're not runny nose. There's nothing going on. They just have this irritating cough all the time. It's usually because of one of their blood pressure meds. Respiratory term for voice. I think I've done this one before, but I'm always repeating my questions sometimes. It is a popular pill. It can actually help with anxiety too. Did you know that? Off-label, they prescribe it for anxiety. Yep. Yep. There's your definitions for all four. One of these questions comes up is going to be really cool. I can't remember which one it was. Which of these conditions in which organ is turned inside out? I don't know why C won't formulate properly. The spacing won't work. I tried to fix it 15,000 times. C is not the answer anyway, but it won't format properly. Word gets so picky sometimes. I'll click something and don't know what I clicked and made it not format properly. Good job, Kinza. A is our answer. There's the definitions for all of them, in case you need it. Inside out. All right. A physician performs the left ventro catheter passes into the left ventricle through which heart valve? If we are doing something to the left ventricle, where would the catheter pass through? Which heart valve? We can go look at our picture of our heart with our heart valves. All of the heart valves are in there. This one was on the CPC exam. Ooh, I'll highlight it then and I'll get it over there if I don't already have it onto our document that says what's been on the exam in the last 45 days. I'll get that put on there. Oh, I could actually probably, let me see, probably copy paste it now. There we go. It's our aortic valve. Do I have that document open? I do. I've got some more stuff I saw somebody post somewhere in our Discord group this week. I got to go find it. We'll put that one there. Is this the one that said she had decision see? Oh, it was just labeled number 3. This is that thing where I thought she said there was 3 decision trees, but it was labeled as number 3. She just had a question about a decision tree. She didn't make any other reference. So that's good to know. I'll throw this one over there on that document, though. That will help. Because I know y'all hate just seeing random words. It's nice to have a question to go along with it. Here we go. All right. Which additional procedure is used to measure the pressure difference across the coronary artery? Is it intra, optical, fractional, swans? What, my love?
The flavors are melting on my tongue. I can taste colors now, Mom. I can taste sound.
So what sitcom are you parroting to me?
Nothing.
Mm-hmm.
Have the Oculus.
No. Did you change the lint trap?
Yes, ma'am.
In the dryer.
Yes. It's a new one.
Is Grandma coming yet?
No.
Where's Grandma? It's 7:15.
She did come in, but she went back to bed.
Did you give her a hug?
Yes. I did. James did it, though. He was on his scrum.
I told him to. Go. You need to do some homework.
I already did all my homework.
You did not do any extra XILs.
I did other things in IXL.
Maybe in a minute.
Okay?
A minute. Yeah. Forget. I won't. I won't forget. Stay off YouTube, too. My child. He gets so crazy on that Oculus. He gets in this monkey room where they're chasing each other, and he gets so competitive that he's not nice to the other kids. And it's like, ooh, no, if I'm in the room, then he's nice. But if I'm not in the room, he's not nice. He's got to be nice. This is fractional. Well, let me look. Well, it's with the diabetes. It's going to be with the diabetes or the hypertension one. Could have been the hypertension one. It's going to be in the guidelines in the front of the book. That's where all their decision trees are. So are you looking in the G pages? Here's the diabetes one. It's on G22. If you're in the 2023 CPT book. It's in the front where all your guidelines are. And I have tons of notes on these guidelines. And so if you ever want a copy of my guideline notes, they are on my website. But this one is right there. So see, copyrighted by AAPC. So I don't want to show the whole thing. I don't want to be mean. But that's where it's at. It's on page G22. That's where all the decision trees are going to be at, in the front of the book, in the guidelines, in their ICD-10 book. And it only happens in their ICD-10 book. And it can be the 2021 version, 2022 version, doesn't matter, but it'll be in the guidelines. No, don't use your 2023 CPT book especially, because you're going to lose all your E&M stuff. They deleted 10 pages of E&M codes that you're going to need. You're going to need those observation and the domiciliary codes, unless you draw them in for 2023. I think the ICD-10 and HitPix would be okay, but the CPT, there's a lot of changes. And all the hernias. You need to write in the hernias. There's a bunch of changes in the hernias and the ICD-10s. Those two sections, if you get those two fixed up, you should be okay. If you purchase the 2022 notes, can they be used for the 2023 exam? Yes, absolutely. I just improve on them because, I write them at the beginning of the year. And then by December, I've purchased more practice exam questions and written more notes. You'll see me during these lives write extra stuff into the notes. And then the next year when I redo them again, I add that bonus material that I learned after I stopped writing them last year. So there is an upgrade to them every year. If you decide you really want to upgrade your notes to 2023, I'll give you a 70% off coupon. Just message me on whatever site you bought them. If you bought them on Etsy and you want to upgrade to 2023, just message me there. But I don't have any of them done yet. Technically, I do have anesthesia up and the guidelines up yet for 2023. Those two are up. The rest I'm holding until I get the 2023 new questions that we're going to get. And I'll go through those and make sure I add those real quick, and then I'll publish those. But you don't have to upgrade them. You can just continue watching my lives, looking at my books, and listening to me. I repeat myself constantly, so it's up to you. But yeah, you can use the 2022 notes to update your 2023 books. Yes, absolutely. Oh, I think this one was it. We had some questions about recently that was on the exam, like what attaches bones to bones, or there's a lot of ligament, cartilage, those kind of questions on the exam. So I found this one today. So I was like, maybe this might be something that's on the exam, but it's a new one I haven't gone over. So we got sprains, tendonitis, atrophy, or strain. So I know it says medical assistant, but this was under a hospital COC practice exam questions. I don't know why it says medical assistant, but it was under COC for hospitalization. Anyway, or outpatient surgery centers, I mean. So if we have a 16-year-old who was in the office who injured their ankle, and they know they had a common disorder that involves overstretching the ligaments, what is that called? For the love of all things beautiful. A, strain, sprain. We've got some tendonitis. It's a ligament. Answer is D, guys. It is a strain. A strain is an overstretching of the ligament. Tendinitis is an inflammation of the tendon. Atrophy is wasting away of muscles. And a strain is overstretching of muscles. I figured be a few that might get it wrong. But there's quite a few that did get it right. That's good. Good job. But having all those definitions down in musculoskeletal, which I do not have at all, I have so many notes in musculoskeletal, but I don't think I've explained. I have down the differences of each type of fracture and what attaches to what, ligaments to bones to joint to cartilage to tendons, what attaches to what. But I even have the types of bones, short, long, flat, sesamoid, and irregular, and those definitions, but I don't think I have the types of injuries besides the fractures. So we're going to have to add that because they've gotten good at us knowing that we've already got the fractures down and the type of bones down and all that other stuff. So one more thing we need to add in for 2023. And one more question and we'll be done. We'll go to something else. You take your exam on Saturday. What notes do you think I need to get? It's Wednesday, hun. You can't copy none of my notes before then. I wouldn't want to put that much stress on you. My stuff is just like lengthy. Man. Huh. Be sure and write what we just wrote for these. Be sure and write that question we did that I posted on what was on the exam in the last 45 days. That's helpful. Where is that document right there? That mitral valve question. Be sure and mark that one. Other than that, at this point, you need to be practicing the questions. And we'll go over that in just a second. Okay, which cell transports oxygen to the blood? Is it leukocytes, granulocytes, erythrocytes, or platelets? We got C's and A's. I've done this question before, I think. Erythrocytes. Yep. Yep. All right. So if you're taking your exam Saturday, be sure you have down what the modifier for the CLIA waiver is and what the modifier is, GA for ABNN, the QW for lab and CLIA. Be sure you have that down. Know the differences between 74 and 70 something else modifier. Be sure you know that. Be sure you know where this place of service page is at, because they're going to ask you one of these numbers on this page. Be sure you know the definition of Category 1, Category 2, and the next page that's Category 3 codes. Be sure you know that. Be sure you know the definitions or where to come to find out what an add-on code is, what a modifier is. Place of service reporting, this last 3 sentences, they usually ask one of the questions are from here, those sentences. Be sure you know where the symbols are, especially in the ICD-10 book, but what the symbols mean. What the prefix and suffix definitions mean. Lateral, IPSI, what hyper and EMIA mean. Be sure you know those. This page for x-rays and radiology, be sure you know where to find this so that you can look for side view, front view, 3/4 view, the body planes. Sometimes that's helpful. Nobody's ever in the ER. Nobody's getting a consult. Check your headers before your CPT code descriptors, meaning new patient versus established. Those are headers. Check those. Clear your answers. Get yourself down to 2 answers. Then you can look up your individual differences of the individual codes. Don't forget you've got parentheticals that are not on the same pages as the codes. Don't forget to look at those. It doesn't matter if the question says ER, 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 ER throughout it. Look for words like admission, emergent admission. That all means inpatient. Every time you see it, they're inpatient, which is 221. They were seen yesterday, the other day. They were admitted last night. Then that means today is a subsequent visit. Whether it's subsequent observation or subsequent inpatient hospital, it's subsequent. Critical care. Critical care. If you are billing your 2991 code, where is it? Right here. Do not go to the CPT code descriptors and try to do the math yourself. You're going to get it wrong. It is wrong. Nothing up here is correct. Ignore this. This is urgent. This is your critical care. Find your minutes and do what they say right here. If your patient has been given 30 minutes of critical care time and you're going to be billing for a trach, we put a trach in, you have to take the 5 minutes off of the trach of the critical care time because you can't bill for the trach and the critical care at the same time and get paid for the minutes one way and then get paid for the doing the procedure and its minutes too. That's double billing. It's fraud. So if you take 5 minutes off of your 30 minutes, then your patient no longer qualifies for critical care and you have to do an E&M visit, which is usually subsequent hospital visit, subsequent inpatient hospital visit. So if you have a critical care that is not like an hour and 25 minutes or an hour and 15 minutes or 45 minutes, if you're really close, the original question has you just a plain old 30 minutes critical care, but then they did a bunch of other stuff that is not located here. It's something that's not located here that we could possibly bill for, then you know that question is just going to be your subsequent hospital visit. If anything that is listed right here is done with critical care, you can't bill it with it. So usually they try to confuse you and try to get you to add vascular access. Gosh gracious, I can't talk today. To critical care, and you can't code that with critical care. All this is included, whatever's here. Critical care for babies, anybody 6 years or older, you can bill a lot of stuff extra. And that is all listed on page 59 if you're in the 2022 book. All of this and all of this. If they're 6 years or younger, you can bill all this. If it is before they are admitted to NICU, if they're in critical care, if they're in the emergency room, if they're in the ambulance, you do any of these, you can bill them. If you're an adult and you're in the ER, you're in critical care, you're in an ambulance, you cannot bill for any of this. If you're inpatient hospitalization child, younger than 6, You cannot bill for any of this. Once you're inpatient, in NICU, you cannot bill for any of this. So pay attention. If the evaluation and management didn't happen until they were admitted to PICU or ICU, then you don't bill any of this. If they're down in the ER, in a birthing center, then you bill this. If they're an adult and they're admitted into the hospital, you can bill all of this. If they're a pediatric patient and they're in the hospital, you cannot bill all this. Hopefully I have not confused y'all, because that gets kind of crazy. Did I do a live on Sunday? I did a workshop on Sunday, and yes, that is posted onto YouTube. You're welcome. So, critical care babies, ER babies, in an ambulance, you can bill all these. Once the babies are admitted into PICU, you cannot bill all these. Adults in the ER, critical care, or in an ambulance, you cannot bill these. But once they're already admitted into the hospital, if they need these, you can bill. Insane. I hope they make that easier next year. Living wills usually is asked about. And on the exam, be sure you know which code is for living wills. It's the one for your advanced directives too. In anesthesia, if you do not have all your anesthesia codes listed there, your modifiers, it's going to hurt you. So go to your HipPix book and find all your anesthesia modifiers and add those there. Stuff like G9, G8, QZ, QX, tons of stuff. Add those there. In anesthesia, they're going to ask you all those questions about whether you need to add in the 99100 code. And if you're not, or if you are, that code is used for if your patient is younger than 1 year of age or older than 70, you add it. But if the CPT code descriptor has an age in it, like this one, this patient is, if you use the CPT code, it says younger than 1 year of old, then you don't use that code. But don't forget, if your answer is number 18, that's a child code. You have to remember to go to your mama code to see if there's an age listed. If there's an age listed, you will not use that code. But if there's not an age listed, then you will use that code. So don't forget that. That will likely be on your exam. The last tricky one on the exam is we have those P1, P2, P3, P4 modifiers we add to CPT codes explaining how healthy our patient is. You can't use it if also that descriptor is in the CPT code. So like this one says we're harvesting organs on a brain dead patient. Well, we have a P1, P2, P whatever. It's called P6 for the status of our patient before we put them under anesthesia. And normally you would add P6 to that if any of these codes are used on a dead patient. But this one is a brain dead patient, so we don't use P6 on this one. So be sure and look at your code descriptors before you add any of those qualifying circumstance codes. You only have 4 questions in anesthesia on the exam, and usually it's those funny little things. Be sure you know what a separate procedure definition is, which is right here. And that's the guidelines in the surgery area. And know your differences between simple, complex, and intermediate in lacerations. That last sentence under intermediate is always on the exam in one way, shape, or form. It's under the repairs header, page 106. It's under the intermediates. If you have a single layer laceration you're repairing and it needs just irrigation due to contamination, then that turns it into an intermediate. So they'll either ask you in a coding situation or flat out have you a guideline to answer about that question. So be sure you know that one. Those are the major things that you should know right away for that exam if you were taking it on Saturday. That info is super helpful. I have one guideline question I wanted to bring in for tonight because it was sort of anatomy. You could look at it as an anatomy and then you wouldn't have to go look up the diagnosis code for it. And I just wanted to see if anybody else could get this question right. Let's see. I don't know how close the answer is. There we go. So this question right here, if a baby, for using our ICD-10 code 080, and don't look in your ICD-10 book, we have a full-term uncomplicated baby. Does that mean our baby is born breech, cephalic, or vertex? What would it be? PJ's taking her exam on Saturday too. CIC, I got y'all a bunch of questions. I've been wanting to do y'all a workshop or something. I've been working on you guys. This is my CIC document. I got a ton of questions prepped and ready to go. I just need to find the time to have, and look, some of my questions I'm getting from my anatomy is from my CIC questions I purchased. But anyway, this one right here. Yeah, uncomplicated would not be a breech, baby. Good job. So if we get rid of A, are we going to be cephalic? Vertex, vertex. Worried about E and M? We'll go over some E and M ones. Yep, you're right. We're going to have a cephalic presentation. So that's pretty interesting. Pretty cool. You don't even have to open your book, but you can and verify that it's right or not. Modifiers. Since I did a report or a blog today on modifiers, of course, I have modifiers to go over some today. So it would be 24, 57, 32, or 62. Don't forget the CPT book does not hold all the modifiers at all. It does not. All the modifiers are listed in your HitPix book. So if you're asked a question about an SN or a QX, and you don't know where they are because you looked throughout the CPT book and can't find them, well, they're not there. They're in the HitPix. This one, where would we be? Court order. It is 32. Good job. What about modifier for alternate laboratory platform testing? Would we be a 90, 91, 92, or 99? Try again, baking. Hey, Allie. Hey, Dirty Red. Called you out, my love. I knew somebody was going to get it wrong because they were going to see laboratory and just think automatically it's 91. It is our most popular one, but it's actually just for the word repeat. Make sure you know these differences. This one's alternate, this one's multiple, and this one's some reference lab for outdoors. I need to add these, of course, to my notes. They're not in there. I should have added them, and I haven't taught about them, so why would you know? Because I haven't taught about them. So that's why when I find these questions, I'm like, oh yeah, I haven't taught about that. I need to, show them that. So it's not you, it's me. I haven't covered it all yet. What about this one? We've got AA, AD, QK, or QY. We're looking for medical supervision by an MD, more than 4. It's 92 MK. Thank you for the follows, Ray and Amanda. It's good to have y'all around. I hope I can help you guys. I've got 13 TikTok subscribers, and they are all going to get their names put in for the free tutoring and notes for Friday. So are the YouTube subscribers, who are the paid subscription, and all the people that email me. Oops, let me go back to our modifier thing. And if you put raffle in the header, I'll enter your name in for free at medicalcodingbyjen@gmail.com. I'm not collecting these email addresses, so just send me anything. Even if it's a temporary email account, it doesn't matter. As long as I get raffle in the header, I'll know to add that into my cookie jar, whatever the name comes up as from the email account, and I'll add that in there. I don't have time for marketing. No need in all that mess. This one right here is going to be our AD. So B is the answer. Because this was 4 concurrent or more. It was more than 4. I'm sorry, more than 4. So for AA, we've got personally supervising. We've got the more than 4. The QK is 2, 3, or 4, but just the more made the difference. And then this one is the CRNA doing it all by herself or himself. Okay, Bacon, time for you to redeem yourself. Which one of these 91, 90, 92, or QW is for describes testing using a special single-use transportable equipment or kit? Thanks for following. I can. There we go. I can change my sticker to that. Follow me. Yeah, that way you won't lose track of when I go live. You'll get noticed. They'll send you out some little alerts. Oh, she's live, because I go live random. What was that, Monday night? I went live another hour and a half after my Monday night live, which I won't repost, and answered a bunch of questions. That won't go up on YouTube because I was doing dishes too. I mean, I was walking around my house, looking at the kids and looking at the Christmas tree and watching me clean my dirty sink. It was just awful, but I was still answering questions. So you never know when I might go live, so be sure and follow if you haven't yet. That way you can get your questions answered whenever I randomly go live. This one, what did Baking say? What did she say? She said C this time. Yeah, there you go. It's C. And I'm mad because they gave a different definition in the question above, and then this question has totally different definitions for each one. And I'm like, what? These are just totally different definitions. Love it. So I have to write down both. You're doing the AAPC final exam tomorrow for your certification is on the 28th. Thank you for helping. Oh, I'm so helpful. That's awesome. You know, you can do a screen record on that final exam because the course won't show you those questions again. You won't be able to see them again. You can either set up your cell phone to video record or you can do a screen record on your desktop. That way, after you finish your final, you'll get a grade. No big deal, but at least you'll be able to see what questions and what you answered them as during your final. If you have questions, whether one of them was right or wrong, you can post them in our Discord or do a Google search for those questions in Quizlet, and you can find the answers and the rationale, or I'll help you, whatever. Well, it's super handy dandy. A lot of people don't get to see those final course exam questions on that last one, but they're neat and new questions that they didn't ask you before in the course. So if you want to keep those are options for you because you won't see them again and you won't be able to copy paste them into a Word document and work on them later. But if you have them video recorded, you can retype them. Yep, we got our CLIA waiver. Is that it? That's all my modifiers I had for you tonight. Okay. I wanted to do some radiology. A couple of people got their scores back and they were a little low in radiology for I don't know what reason. It's usually one of the more easier ones. And then we'll do some E&M. So just a couple of these radiology and then we'll do E&M for you guys that are doing your exam on Saturday. Oh, wrong one. I need to do this one. Let's bring this up bigger so y'all can see it. So remember, number one thing when you're going through this exam, do not read the questions. It's just gonna slow you down. Don't second guess yourself either. If you end up with 40 minutes left over for your exam on Saturday, walk out. Go have lunch. Be happy. Don't go second guess unless there is one question, maybe two, that is bugging you, that's stuck in your head. Like, I really need to go back to this. I'm just spending too much time. I'm just going to pick C and I'll move on. You can mark it on your test booklet and say, go back to it. But don't spend that 40 minutes reevaluating what you've already done. No. Only go back no more than 2 questions. Just walk out early and be happy, please. It's not going to be helpful. Don't reevaluate anything that you actually found an answer for and you're happy with it and you moved on. Don't do that. I had somebody do that this week and then she missed by 6 questions or 7 questions. She wonders now, what if she had just walked out her 40 minutes early? And we'll never know now. So just do your process of elimination. Look for your similarities. Get through with that exam and do not second guess yourself. Walk out. Let's see how you do. Everybody be looking at you like, God, she's done so early. Wow. They'll all be jealous. Our 07 is a child code. We got to go look at mama code. What are we doing in this one? We are doing a kidney, right? Because we got to go look at mama. Kidney imaging. Some of them might not be in kidneys. I don't know. What's my 2.5? My 2.5 is kidney too, but it's non-imaging. The one, this one is non-imaging. This one includes imaging. No imaging. The 00 is our mama code. Yay. This one is just mama. She has imaging. This one has bonus crap with it. And then the 08 has bonus crap with mama too. So we just need to see, first thing with bonus crap, is this non-imaging? If it is, we know what our answer is right away because we only have one. So let's just check. Right there. So we only have one that is non-imaging. So it's sort of like my premise that I tell you guys all the time. Headers before descriptors. And that is sort of one of those that is a header because the other codes are all underneath that mama. Mama was included, and then this one, and then that one was included. Well, this one, the 25, is by itself. There's no new header, but technically there is a header because this one's a separate mama code, which this one's non-imaging, and this one and everything underneath it is all imaging. So those are your headers before your descriptors. A lot of your questions will be answered that way so easily if you just think about more of the header situation than you do worrying about GFRs and flow and filtrations and plasma. All that is meant to confuse you inside all of these child codes. 100%. Does that make sense? Try to break it down to really simple, simpler, easier stuff. And also having your one-word differences like I do, non-imaging, and then we've got imaging circled over here in red, meaning that's important more so than anything else. That makes a huge difference. That's my one-word differences. I don't worry about my child codes before I clear my mama code, which was the imaging. So I have my imaging mama and my non-imaging mama here. I clear my mamas before I worry about my one-word differences in the individual ones. If we weren't imaging, then I'd know I'd look up my differences right here between those codes. Sorry, gotta rotate your screen. Sorry. You'll be able to rewatch it later and flip over your computer screen. Thanks, guys, for tapping the screen. That's awesome. Y'all got me over 10,000 likes. I think that's like a record. Oh, it is I've got a little cup thing that showed up for getting 10,000 likes. So I think that's a record for me. All right. 78 and 80 are the closest. Yeah, because they're both 77s. So I'd run to those two first because this one is a 72 and this one's a 78, way far away. So let's go to 77s. Let's go see. I'm just looking at them as numbers, which is kind of a hard thing to look at, but I'm just looking at them as far as the closest numbers. 77, 80. I love all the hearts. 77, 78. Where are we at? 78. We are CT because it's its own mama code. And we're just going to write down what it is. And then 80 is a DEXA. So DXA. So are we doing a CT or a DEXA? We see we are doing a CT. So that's simply the answer. Just clearing that. I'd pick that answer and move on with my day. That's it. You don't have to worry about bone mineral or spines or anything else. Just look for the codes that are numerically the same or close and see if you're under the right header, which we are, bone mineral density. You see I'm under bone studies. So super easy. As long as we're underneath the right header, we're good to go. if you got your one-word differences, which there's mine. I'll try not to do the side view. CT, DEXA. Just grab those words and do your search. It's all you got to do. One more, and then we'll move on to E&M. All right. Which two are we keeping? Y'all are going to do this one. It looks like we can keep two with this one. What would we be keeping? Thank you for the shares. We got 9 of them. Yep. Yep, Becca. Yep, MK. We're going to keep A and B. Let's check those codes out. Look at our header. Make sure we're under the right thing. 742. 742. 742. 40. 74240. All right. We've got an X-ray with this one. What header are we under? Gastrointestinal tract. We're under GI. Is our header. 40 is an X-ray, and 60. Where's our 60? Where are you at? Not 60, 40. 40 and 46, sorry. Just whether we did double contrast or not, that's all. Single or double. That's all we need to know. Are we under? Yep. Did we do single or double? Contrast. Just look backwards for the word contrast and see if you did. One or two. Double contrast. Good job. Yep. B is our answer. Yep. Good job. All right. E&M. E&M. Ooh, what we got going on here? Make it bigger. E&M. We really don't do a lot of the process of elimination here. You just need to know what your codes are. What's our 214? What kind of code is it? What's your header for that code? What is a 99214? If I was going to my 99214, my header is that big red one right there, which is established. Trying not to do sideways, but established is my header for my 214. That's my first thing I'm going to clear with any of your E&M codes. Go find your header first. So this one's established. Our 99222, what's our header for that one? Admit hospital. Yep. This one's new patient. And this one, 223. Is that subsequent or not yet? I never know. 223, nope, that's still initial hospital. That's admit hospital. Admit hospital. It's kind of weird modifiers for E&M, don't you think? Don't those look weird? Those look a little weird to me. So don't read your question. Go from the bottom up. Make note of your MDM. You can highlight that. You can also highlight your examination. And you can highlight your history. So whatever we're doing comp, moderate. Where is our patient? They've been admitted, and this doctor did it, and that doctor is who we're coding for. So he is the admit doctor. So check your 222. Does it go comp, and then your MDM? Is it moderate? It is. They all three match. So if they all three match, you know right away you're in the right area. And that one would be a B. A lot of the question is going from one doctor to another one. I don't know. It's crazy. Just always pay attention to the last sentence of all your E&M questions, because a lot of times they're not even asking you anything that's going on here. Read the last sentence first. Check out who am I coding for, and then as you're going back up, highlight your 3 components, your history, your exam, and your MDM. That's it. That'll get you down to where you need to be. I think I've seen these so many times, I worry. Okay. Just looking at the answers, is there anything that has a coding irregularity that we would not code? Thank you, Twinkle. Good night, Annie. Yeah, we wouldn't code that established patient with any hospitalizations. It's one of those things you just cannot do. We're not going to schedule or bill regular office visits with hospitalizations. Also, I see smaller E&M codes, because if you look at your 99231, you see that it is problem focused, straightforward. But then you see your next code, and this would be day 1, day 2, day 3, day 4. Would we code day 2 with a expanded problem focused and a moderate MDM? Usually when patients get admitted, they're sickest in the front. Their first day is their hard decision making. The second day is just continuing to monitor them and hopefully discharging them after that. It's kind of unusual to have them progress and need more decision-making skills on their second day of admit. So these both look really out of place for me. This one looks great. We're at a level 3, then we're at a level 2, then we're at a level 2, then we're at a level 1, and then we've discharged them home. You see how they're going down in day level? That's how you want to see it admission. It's super hard at first, and then we get you better, then get you really well, and then you're going home. Plus, yeah, the 17 is way whack. That would not be used with any of these. I bet the 355 wouldn't be either. So yeah. And they're asking you on your last sentence, of course, to code 5 days. So the only answer with 5 days is 1, 2, 3, 4, 5. Anyway, so it's D. If you just counted how many CPT codes were in each answer, you could still get the answer. But that observation about the level 3, the level 2, the level 2, the level 1, and then a discharge home is perfect to even look at too, without even reading one word of this question at all. Y'all got this. You can look at these questions, I think, and they are easier than you think they are because you're trying to code, and you don't have to code. Y'all just have to pick out the right answer. You hope that question comes up on the exam. I do too. I hope so too. Thank you for the fabulous. That's awesome. 13,000 likes. That's awesome. Thank you guys. And 11 shares. Well, We don't look for similarities a lot of times in E&M, so before y'all start picking, this one is an office consult, right? This one is an office consult. This one is a hospital consult. And this one is a new patient. In E&M, we really don't look for a lot of similarities. I mean, if one answer is in there 3 times, like A, B, and C are all the same admit at hospital code, and they're just asking you about a modifier or something, then it's okay not to do the process of, not to look at every single one. But other than that, you really need to just go look all the E&M answers up, the very first codes, just to see what the differences are. And by the headers first. These two are obviously different, but they're under the header of office consult. This one is a different header. It's hospital consult. And then this one is under another header, which is new patient. Clear those first, and then we'll clear, if it happens to be these two codes, the differences between them in the MDMs or the time. Clear the headers first. Clear the headers. I wish I had a better word for that. Clear the headers. Okay. If the insurance company is requiring a second opinion, what can we bill? Do we bill the office consults, hospital consults, or new patient? 32 is mandated services. You could get rid of now any answer that doesn't have it in it because you are going to need that modifier, so that's handy. And remember, nobody gets a consult and nobody's in the ER for the CPC exam. So we'll get rid of those consults and we'll stick with our new patient. Because it wasn't the primary care physician's idea to request another physician to see that patient because of a medical need, then they don't get the consult. They have to bill for a new patient. It has to be the MD's decision. The insurance company does control everything that we do, but billing-wise, this is the only real decision-making that we do for that in our healthcare system. Oh, y'all remember all those peds I said you can do or can't do depending on where they are located. This is one of those questions where that comes in handy to know whether you can bill these extra codes that are on page 59 or not for a pediatric patient. You have to remember and know where they're located in the hospital when they're getting those treatments to know whether you can bill those or not. But the first thing we're going to do, we see that we have 3 of them that are the 65 and then 1 lonely bird that is the 68. It's probably one of those questions you can go and eliminate that one because it's such an outlier and stick to just these 6-5s. But other than these type of questions, I would look them all up. We do have a guideline in the 65 that says you can't bill with the 64 if you look in your parentheticals, so we know we get rid of that. So truly, now our answer and our question is simply asking us, do you know, based on your patient status, can you bill these extra treatments? If the baby has not already been admitted into NICU, then you can. So if all that treatment was done before they got admitted, then you can bill it. If they're already in NICU, you can't. So what do you think the answer is? Where were they when they got ventilation and intubation and their umbilical line? Where were they? Where's the baby when they're getting this? You going to be nice to those children?
Yes.
You can't be mean to those kids. What have you got in your pocket?
My thing. You left it on Grandma's desk.
Sorry.
Okay.
Put it on my desk. There we go. Okay. It's under the sink. Yeah, they were in the delivery room when they resuscitated the baby. They didn't take the baby up to the NICU and then start resuscitating it. They did it in the delivery room. So yes, you can, Bill. Yep, D is your answer. Now don't worry about the X on the end of this. That just means anything in that header, which are 99221, 99222, 99223, those are all admit hospitals. So anything in admit hospitals could be an answer. What's our 99234? What is that one? What kind of code is that? Good night. See you later, Miss New York. Miss New Yorker. One of my best friends lives in New York, and her mama got to come home today from the hospital, so that's a blessing. I mentioned her on Monday. She did get to come home today, so yay. Good job. Thank you for tapping all the likes. This one is observation, but it's admit and discharge all in one. That's its header. What is our 3-8? What is our 3-8? Not yet, MK. Maybe in 2023. For right now, it's observation, admit, and delivery. If they're taking, I got a lot of people that are taking their exam Saturday. And MK, did you see that I signed you up for tutoring this Friday with Miss Edwards and Chrissy, my 3 little ducks? If you can, if you have time. It's 7 a.m. your time, though. It's early because of the time change. But it's okay. I can give you the replay and you can watch it later if you can't attend. Okay. Tutoring can be scheduled at medicalcodingbyjen.com, my website. There's a whole tab that says tutoring. You can schedule there. My calendar's there. You got it. MK has paid for a year's worth of tutoring. She has above and beyond paid for tons of tutoring, and I have a group, a small group one that I'm doing on Friday for my little ducks that still need a little bit of help to pass. The chapter for tutoring is totally up to you guys. Thank you for the holiday stockings. Those are so cute, Micah, sorry, and Sunshine. I'm so bad, Micah. This one is a discharge. Yes. So let's see what's going on with our patient. Ooh, y'all can see the whole question. Get it all in there for you. So we have a Medicare patient. What does this word tell you? Which one do you delete right away when you see that word? One of these can never be done by a Medicare patient. Which one is it? Oh, look at this. How come I'm doing soccer balls and little soccer things? That is so cute. Oh, I could play with this all day. Observation, that's right. Very good. We cannot do any observations. Anytime you see that word, you know no one's in observation. So if they were admitted to the hospital and now we're doing discharge 4 hours later, which one is your admit and discharge all in the same day? For a Medicare patient, it's same day. Yeah, it's B. Can't just discharge them when we didn't admit them, so it's kind of weird. It's an admit. Yep, it's very weird. You can't discharge them if you haven't admitted them, and since it's the same day, you wouldn't have charged your admit yet, so it's crazy little question. But you see how they trick you with something that one word is the difference. So next to your 9922s, write same day Medicare. Those words will definitely help you out during your exam. That way you don't forget them. All right. Let me see. I'm going to move up. Make sure. Oh, somebody asked me about the process of elimination. This question, I have it highlighted for that. So I did this one during the workshop. So if you want to know how to do the process of elimination, this is what I see when I see the numbers. So you see how all the answers have the very first code is the same. Then the second codes are all the same here in green except for that one lonely duck right there. Well, that lonely duck gets taken away just simply because of that area being different. I'm going to keep the ones that are the same codes. Then I'm going to scoot you over here to the third column, which is its own independent column. And everything that isn't blue, we get rid of. So we're going to get rid of C now, too. Then the purple ones are their own independent column. Even though I've already got rid of this one, it doesn't matter. It's still purple and purple. Those are still similarities. So then I'm going to get rid of this one. So the only answer it could be is D without reading anything. That's how you do the process of elimination without reading a word and getting the answer right. It's scary, but it works. If you practice it and do it for your AAPC practice exam questions, and if you can figure it out, see how many times you're right like this, just with guessing, first off, without reading one word. You'll pick up on how to do it, and you'll see that 90% of the time, the answer is going to be correct that way. Easy. Awesome, awesome, awesome. Awesome, Virgo. Hope I can help you. You are a workaholic, Miss Virgo, right? You are going to do great. If you are anything like your astrological sign, you will study and be so dedicated to this, you will get it done. That's awesome. Love the hardworking Virgos. You will do great. You will overdo. Try not to overdo. All right, let me erase this one. I got my marks all over it. Erase, erase, erase. All right. Scoot you over. All right. What code is our 231? Hi, Cynthia. I hope the elimination works for me on Saturday during my test. Me too. It's going to It really will. Somebody took theirs last Saturday, literally walked out with 40 minutes ahead of time. Yep. No worries. Process of elimination will help you out a whole bunch. Plus, it'll save you time for your E&Ms where you need to go write down what each one of these codes are. 99231 is where? That is subsequent hospital. This one's admit observation. This one's admit hospital. And what's our 32? Subsequent hospital. Subsequent hospital. Figure out what headers they are first before you worry about your question. Then go straight to the bottom. Find out what they're asking you to code for. Which doctor? Who am I coding for? What am I doing? All right. So we're coding for a pulmonary consultation has been requested. What would be coding? Thanks, R-head. Without even reading the questions and got 18. There you go, Danny. That's awesome. Good to hear. I know it's scary, and you think going in here and you prep yourself with all this stress and pay for all this course, and you really want to be a very good coder, and you want to prove that you are a good coder. So you go into this exam trying to know all your routes and all the different intricacies of medical coding and all these different body parts. And really, you can do it just by looking at the answers and doing the process of elimination. And it's simpler than you think it is. And you can get away with not reading a question to answer it. It kind of makes you feel cheated, you know? So it's not a route that most people go to think about doing, but it does work, and it keeps you out of the propaganda in these questions. They write them with a psychologist so that they know human nature. If I say these words, they're going to lean to answering the question wrong because it's human nature. So you have to take human nature out of this exam or you're not going to pass. You're going to keep failing it. So you have to do this exam differently is my suggestion, and take human nature out of it. Don't read the question first. Go straight to the answers and then do word searches for your differences. Our patient was admitted a day ago. So you know we're subsequent no matter what. We're subsequent, so we're not billing an admit or an admit. All we have to do is match our history exam and MDM. So now we get to look for those words to see what our differences are, right? They're both subsequent hospitals. We're going to continue with antibiotics. Thank you, Twinkle. I'm going to act like I'm not human. That's right. They put E&M in the last 2 chapters of the course too. So by then you're exhausted, tired of looking at any of it. And you know, when I took my CPC exam, I refused to learn E&M. It was too much. I didn't want to deal with none of that. I don't care where the patient is. That was just a nightmare. After I learned cardiology and tegumentary and radiology and I didn't want to hit picks and ICD-10. I didn't want to learn it, so I didn't. And then nobody told me after I paid for a year's worth of information from a big reputable place that there's a such thing as out-of-code sequences, so I couldn't find anything in medicine and lab. In the medicine section, all the codes I couldn't find because nobody told me that they were going to be read and going to be in a missing spot. that you couldn't look them up numerically. So I had 3 sections that I totally guessed at and still passed. Just because I did the process of elimination and didn't read none of the answers anyway, questions anyway. But it's bad enough you can't even find the codes when they're out of sequence because no one tells you to put the page numbers down beside them. Jeez. If I'd have known that, I'd been able to do it because I just needed to go find their headers, but I couldn't find their headers because I couldn't find the codes. So, unfortunately, because the book is over 1,000 pages, I have a really hard time getting even one chapter posted up on Etsy or my website. I think I might be able to do a bundle on my website if I do zip files. I'm working on that right now, but I can't, especially on Etsy. But, sorry, I know this zoomed out. Okay, so on Etsy, I'm writing them down. %Jen, and then I will be CPC. So on Etsy, if you're going to buy 2 or more whatevers, you can put in the coupon code 30% Jen to get money off. If you're on my website, Medical Coding by Jen, in that shop, you can use I will be CPC coupon code. And that'll help you. They are cheaper on my website because I don't have to pay Etsy fees there. So they are a little bit cheaper. Just saves a little bit on there. Plus, I have the ICD-10 and HitPix ones on my website. And those are a lot cheaper because I'm not having to pay Etsy fees on them. So let's see if I was going here. Where's my website at? Right here. That's the blog. But I do have a shop here too. I have them categorized. If you only want to look at the CPT notes, you can just click that tab underneath shop. But if you want to see it, everything I've got 3 workshops. You can get the repeats on, the eyes, the digestive system, and the cardiology for $10. You'll also download a PDF that has all the vocabulary terms with them. And then at the last page of that PDF, it has the link and the password to watch those on Zoom. The rest is all here. The 2023, the notes are all here. And if you compare the prices to what's on Etsy, they are cheaper. And the ICD-10s, this one covers COVID, pain, cancer, and hypertension sections, all for $20. Or you can do the pregnancy scenario ones for $8 or $9 for sepsis and HIV. So it's not bad. A little bit better, and then you can hit load more if you need more, whatever you need. But they're all here. All the guidelines for diabetes and all my diabetes examples are $6 on the website. So, and the entire HitPix book on what you need to note is $16 there. But you can still put in the coupon code if you need it. If you need all, hopefully you can just go to my members tab and go to CPT book prep, and you can follow the instructions and just click on a picture, and then it'll tell you what to do through the entire book to make your own notes like mine. I've got tons of pictures here, and then you just click on them. It'll show you the instructions on what to do. Even the ICD-10 is here, and I also have extra bonus material for tons of stuff. So, and what the child and parent code relationship, I have a whole document on that too. So you can even make your own notes, just look just like mine. There's even CPT book prep videos there. There's 3 on digestion. The rest are on YouTube, but you have to be a paid subscriber to see those. But I have the 3 free here. So that's all there. And there's the tutoring and my tutoring calendar and the workshops are there. I'll do another workshop in January. And I think that's about it for tonight, unless anybody has any questions. Thank you so much for all the taps. 18,000 likes tonight. That's great. 14 shares. That's so cool. Oops. Didn't mean to do that. Thank you, Twinkle. Thank you, Temple. Yep, that's all there, Richie. Absolutely. Don't forget to please join the Discord if you're under the social media tab right there. I've got a link where you can just click on the, oh, thank you for the, I know I need to put my face on here, don't I? I've got this click join now for our Discord group. It has a lot of the same material too, plus others have been posting copies of their own little pages and things that they have in certain sections. This Discord group's got lots of help, so even if anatomy, I put anatomy terms in here and practice exam questions. I'm sure there's pictures of certain things in here. Thank you for the chipmunk. Oh, he's cute. Look at him dancing. There is just, if you scroll, there is stuff. People post what they did for their problem situations. They're, of course, being respectful and not posting my pages of each notes. Thank you very much. But if they have notes that they think that can help you, like a lot of people don't know what's in the right upper quadrant. And it's one of those things that I said, I didn't have in my notes. I need to put in my notes. Well, as soon as I said it, they were posting it in the book and they did it themselves. And there's a lot of helpful info in here too that y'all can find. And that's just the anatomy tab, much less the med term and everything else you've got in the Discord. Plus, if you have any issues, the main chat room is right there. You can always post. You'll keep up to when I tell you I'm going live. I thought I posted up, let's go live in here. But, oh, there we go. Let's go live. So you'll know when I'm live, and plus we can have all kinds of conversations. There's my modifier cheat sheet that I had in 2021. I didn't put it in the book for 2022 notes, but since we've got that cheat sheet little thing on the sidebar of the CPT book, I didn't put it in there for 2022, but still kind of handy. Thank you for the dancing beaver is what he is with sunglasses, Richie. You are awesome. It says 8 Mountain Time, but aren't you in Cali? You seem to be an hour before me now for some reason, MK. So I kept thinking it was going to be 7 your time. I know we're an hour difference. Time zones are the devil. Oh. You're in Illinois? I don't know why I was thinking that. No problem, Virgo. The tutoring is for a small group. These 3 students have been with me for a year. I know Miss Edwards has, and Chrissy, I know since April of last year, and they have paid so much for tutoring. They have just hours and hours of tutoring. So I'm doing a special small group for them because they did not pass their last attempt this month in December. So I am doing this for those guys just because they've already paid so much in tutoring, and I can't charge. It hurts my soul to charge anybody anything for anything anyway. But then to have them pay for April through December and still not pass, it's just, I can't charge them anymore. So that's why this is what it is for those guys. I'm sorry. But, yeah, so they're going to be with me for until they pass. If it takes us 1 year, 2 year, 3 years, they're my only 3 little ducks that haven't passed yet. So out of the 2 years I've been doing this, so and they've paid a lot in one-on-one tutoring individually, and it doesn't make sense to keep doing them individually and taking up that time when I can do the 3 together and do them all 3 at a time. Instead of spending 3 hours a day for 3 repeats, I can do 1 hour with all 3 of them, and it frees up more time for new people too. So I'm just trying to help them out and help you guys, new people, get in too. So anyway, that's my thoughts on it anyway. I hope it helps. And Miss Go-Kart, you know you're included too. I keep forgetting. You can come if you want to. All right, guys. Not the black sheep. No way. They're my babies. They are just too smart. They are really good coders, just really technical coders. MK especially, just technical. I mean, like doctor knowledge technical. And they got to let it go. They got to let it go. It's easier than they're making it. They got to let it go. Let's clear some headers first. Let's do some word searches. It's easier. They're just way too good. Way too good. Way too good of a coder. They could go and get some ER charts and code right away, and they'd know how to code it. They would be great at it. But these questions from AAPC are just written psychologically to push you to the wrong answer, and they're falling for it because they're looking too hard into the question. So I gotta get them to let it go. I'm gonna start singing that Elsa song the whole time while they're doing tutoring or something. Let it go, let it go. Time would not be an issue if you were not reading those questions. If you weren't doing what I preach and not reading those questions, then you would be walking out of there in 3 hours and not 5 hours. That's why you finished with an hour to spare. My goodness, TikTok Mom, do we have any results yet? Hey, Twinkle, you're awesome. Look for the helpers. Yep. Virgo's in California. You have the Optum ICD-10 book. I know. You'll be okay. Yeah, you'll be okay. Yep, if they do give you a decision tree question, it's one question. It's just one on the exam. You can miss 30 questions, so it's okay. It's just unfortunate. If they would let y'all know on the website when you read what to prepare for the exam, that one of your guideline questions will come from a decision tree that they only put in the AAPC book, then none of y'all would end up with Optum books or other books. Y'all would know what you needed. It's just weird. I don't know. Yep, all the social medias and the different names, they drive me nuts. Absolutely. You thought you were given the wrong test, JJ? That's funny. Look at her. She passed. Yeah, everybody has different names, and I don't know who's who on half the stuff. But yeah. I've probably already congratulated you, posted about that you passed and all that stuff, and been talking to you, but I didn't put 2 and 2 together that you're TikTok Mom. Yeah, that's okay that they pay for Optum. That's great. Free books are free books. That's worth it. Mouthy girl, there you go. That's awesome. You always come up with the best names. This live is about a medical coding certification exam. If you ever wanted to get into medical coding, I help you pass the exam from the exam point of view. I do live TikTok streams and teach for free Monday, Wednesdays, and Fridays here on TikTok, 6:30 to 8:30 Arizona time zone. It is 8:42 right now. I'm just now finishing up. I also do post these replay TikToks on YouTube, and that's how you can find me on YouTube. And my repeat lives are under my playlist under repeat lives. So I have 189 of those videos. And my goodness. Oh, I was wanting to know, how in the heck do we sort them? Okay, off. You can sort them by last video added or date added. I guess date added would be fine. I mean, I add them in order. I don't know. But let me hit off of that. So they're supposed to be all in order, but I don't think they'd put them in order, but I put the dates in them. So that's like Mondays, Sundays, Mondays, something like that. We go backwards, and they're all there in titrating order until you go all the way back for the last 2 years. But if you need or want any of the workshops, which I have 14 of those in, those are for the subscribers to YouTube and the book prep. If you catch the lives while I'm on YouTube and I'm doing the book prep, then you get to watch them. Everybody gets to, but just the replays I put as the subscribers, because I'm supposed to be making them some extra material, and I don't know what to give them for extra material. The TikTok tips and advice, these are shorter videos. I have a whole series on E&M, back to basics, explaining what a new code is, to what an established patient is, to highly advanced coding in E&M. That's a cool series. There's like 6 of those here, but they're only like 7-minute long videos. Those are all the shorter ones, and everybody has access to those. One cool thing about if I'm going live now, YouTube let me know this week that people can, and I can, give out free subscriptions for people for a month. Like a lot of people that do pass and they've used me to help them pass their medical coding certification, they want to pay it forward and buy somebody some notes or some tutoring. Well, now you can buy them access to the membership for a month too, but I think it only happens when I'm live that we can see that option. I'm logged on as somebody else right now, so I was trying to figure out where that option is, but I think it happens when I am live. So we'll have to go play around with that option and see what we can do, because YouTube is in charge of giving it away then. They will pick the person that is the most interactive or always watches the lives or makes the most comments according to them. And if somebody pays it forward and gives away a free subscription to my YouTube channel, which is, it's $5 a month, that YouTube will give it away during a live. So that's cool. I don't have to worry about doing the contest myself and writing all those names on the little cookie jar. So that's cool. So I was trying to play around with it today, but we'll figure it out. Yeah. Thanks, TikTok Mom. I will see you later. I'm going to get off here too, go hang out with my kids for a minute, make sure the kitchen's cleaned up. We may come on back and do some YouTube book prep if anybody has some time. I'll let y'all guys know. If not, I'll be back definitely on Wednesday night. We'll do 2 more hours of practice questions. And I will see y'all then. Good night. You're very welcome, Lovin. Good to see you. Oh, yeah. I'll see y'all later. Get to play with all these new options. So cute. Good night, guys.